Greetings and welcome to Mental Health Trailblazers, Psychiatric Nurses Speak Up. I'm your host, Indrias Kassaye, and today our focus is on the mental health impact of the food that adolescent and young people consume. Specifically, we're exploring the role of nutrition and what that means for the mental health of youth from marginalized communities of color in America today. Joining me for this conversation is SAMHSA Minority Fellowship Program at the American Nurses Association, recently graduated doctoral fellow, Dr. David Agor. Dr. Agor, welcome to Mental Health Trailblazers.
Oh, thank you for having me.
And let me start by asking you to share a little bit about yourself and your background to our listeners.
Thank you. I'm a doctorate prepared nurse, political scientist with a clinical preparation in psychiatric mental health. I graduated from the University of North Carolina, Chapel Hill with a DNP, and I'm also studying my PhD at the University of Pennsylvania. I'm Nigerian. I migrated to the States over a decade ago. My program of research and scholarship includes mental health outcome for SGM population with intersecting minoritized identities and nutritional psychiatry. My DNP project looked at exploring psychometric scale to assess multiple minority stress for SGM people of color. I'm very proud of that work, and that is what I will be continuing at UPenn. I'm really proud of that work, both personally and professionally, because as a Black gay man growing up, I was looking for an adult who had the courage and the impetus to lead their truth and to be represented in the research and in the literature that I read. So unfortunately, that did not happen for me. So growing up, I understood the value of representation. So that was one of the things that continued to inform my research and give my research grace, is that far be it from me to deny another young child a role model. But today I'm here because of my work on nutritional psychiatry, which is also something that is very close and dear to my heart. It brings joy to me when I talk about nutritional psychiatry. So yeah, that's a little bit about me.
Thank you for that, Dr. Agor, and I look forward to exploring much further with you your whole area of focus in terms of your research, your work going forward, studying the mental health conditions and challenges that sexual and gender minoritized communities face. Today, we are focusing on nutrition. So if you could tell me why you chose to study the impact of nutrition on mental health, and what questions or problems were you trying to address as you did your research?
So I stumbled upon nutritional psychiatry during my doctoral study in public health. So we were talking about primary prevention, upstream measures. What is primary prevention in mental health? And some of the things I was seeing, psychoeducation, it didn't hold much for me as a person, right? And because in academia, we want to see the data, we want to see the mechanism of action, right? So that was how I started researching, okay, what can we do to prevent mental illness? So I now stumbled upon nutritional psychiatry. I was like, wow, this is like eureka moment for me. But to me, that wasn't primary prevention. This is primordial prevention, a step above primary prevention, because we are talking about preventing risk factors, right? And to me, that was the Holy Grail of upstream measures. We have data backing up that we can use this to prevent people at risk for getting mental illness. Not only that we can use it at primordial prevention, right? That it's also transdiagnostic. It's across different diagnoses. You can use it in mental health, you can use it in cardiology, you can use it in every other thing, downstream measures, right? And also the fact that in mental health, that we did not have good evidence to back up what psychopharmacology, right? We were just chasing one symptom after the other, especially, looking at the data. The STAR-D trial was one of the eye openers, right? That we saw that a lot of our patients failed their first antidepressants, right? Then there was another study in 2022, a meta-analysis showing that over time, people who are on antidepressants didn't have any significant quality of life compared to people who weren't on antidepressants, who were both depressed. So over and over, there were data, there were evidence showing that what we are doing right now is not working. And mental health is getting worse and is getting worse, right? We cannot medicate everybody. So what can we do at the population level to improve mental health outcome for everyone? And to me, I might be biased, but nutritional psychiatry was the answer. And we have data and evidence to show that it actually works. What we have seen is that nutrition was vital to improving mental health outcome for people, even those who had mental illness. One other thing that we also see that it was vital for in preventing mental illness for at-risk population. I know that we're talking about adolescents, but I'll give you one example. There was a big study that was done at Rush University that they looked at people who were at risk for Alzheimer's diseases, right? Who were placed on Mediterranean diet. Over years, there was a significant reduction in progression of developing dementia for those on nutritional psychiatry, quote unquote, Mediterranean diet. And I will preface to say that, when we look at nutritional psychiatry, it's always usually done and said through the Euro-Asian perspective, right? And I want to correct that assumption that nutritional psychiatry must and should be done with a cultural congruence. What I mean by that is that when you look at nutritional psychiatry, what is critical in it is the component of the food. It's not a diet. It's not this is the component of the food, the pre and probiotic food, right? Fermented food. Across every culture, there is fermentation in their culture. So you as the clinician, you as the researcher has to research and understand what is it in the element of nutritional psychiatry that is congruent with this culture. And that is why I tend not to talk about a specific food or I tell you the mechanism of action, I tell you the precursors, and you as the clinician now have to do the work to find out the community that you're taking care of, what is culturally congruent for them.
Okay, so if I understand you correctly, Dr. Agor, part of what you're telling us is that the food that you eat, including, and you just mentioned foods that have undergone the fermentation process, those things have a direct impact on your mental wellness, right? So explain that connection. I come from Ethiopia, so one of the foods that we eat is injera, and injera goes through a fermentation process. As the teff is processed and the dough made to rise, there is a fermentation process that goes there. That's our daily diet. What is the connection between that and mental health? Because a lot of Ethiopians will tell you that they don't feel good if they haven't had their injera every day.
Okay, so I specifically don't know about injera, but I will tell you what fermentation does, right? So when we ferment food, okay, let me take a step back. Let's talk about what is nutritional psychiatry, right? Let me explain what nutritional psychiatry. Nutritional psychiatry is a new branch of psychiatry that looks at harnessing the power of nutrients to improve mental health outcome. So if we ever talk about precision medicine, biohacking, or this and that in psychiatry, it has to go through nutritional psychiatry, right? And it looks at improving the microbiome. What we know about microbiome is that the more diverse your microbiome is, the more healthy you are overall. And why is microbiome important? And what is microbiome? Microbiome is the small living organisms in our digestive tract, the ENS, enteric nervous system. Now we call it the second brain box, right? For example, more than 90% of our serotonin are stored in our digestive tract, right? So it is imperative, it is important that the ENS is in homeostasis. So now stepping back to, I'm going to now discuss, I'll try as much as possible to not get in the weeds and limit this explanation to 4 mechanisms of action. Then I'll answer your question. 4 mechanisms of action of how nutritional psychiatry work. 1, microbiome. 2, inflammation. 3, HPA axis. and BDNF, right? Microbiome, which I did explain a little bit, which are your little microorganisms that live in your gut, and when you feed them the right food, they synthesize neurochemicals. So a good example is that we have seen that some E. coli, some strain of E. coli, because when you hear E. coli, people usually think that, oh, E. coli is bad. No, there are strains of E. coli that are actually neuroprotective, that they synthesize GABA. What does GABA do for you? Your chill hormone, like your chill neurotransmitter, just to be at the simplest level of explanation. GABA is what you need to calm down, right? If you are hyper, we give you benzodiazepine, binds to the receptor, GABA A receptor, and you calm down, right? That's a very simplistic explanation of this. Then you talk about inflammation, which is number 2, right? The mechanism of action. What we have found out across board is that people with mental illness have a very high inflammatory process. A new research was able to correlate the severity of depression with the severity of inflammation. What we also know is that most antipsychotics, especially our second generation antipsychotics, reduce inflammation. They are anti-inflammatory. There's a correlation between the efficacy of antipsychotics and reduction in inflammation. Hypothalamic pituitary axis, which is the HPA axis. What we do know is that in mental illness, especially anxiety, there is an upregulation of HPA axis. And it's also correlated with the inflammatory process, right? Because we do know that a higher level of inflammation makes the blood-brain barrier weak, right? And you will see that there is an upregulation of HPA axis, and it releases your stress hormone, your cortisol levels goes up, you amped up, right? So that is also another mechanism of action of nutritional psychiatry. What we do see is that those anti-inflammatory food that we consume, right? Your flavonoids, your berries, your flavonoids, your fermented food, which are anti-inflammatory. These things which are core tenets of nutritional psychiatry is how nutritional psychiatry improve mental health outcome. Then the last one is BDNF, popularly known or colloquially known as brain vitamin. It's very, very essential. What BDNF, brain-derived neurotrophic factor, what it does is that it is essential for neurogenesis. It is essential for neuroplasticity. So especially in the hippocampal area, right? So what we know is that neurogenesis is happening throughout life. Because initially it's like, neurogenesis happen at the development of life. That's true, right? You are developing about 2 million neurons on a daily basis as an infant. But as you age, that reduces. However, when you are eating healthy foods like flavonoids, there was a recent study from Harvard in 2021 that showed that older adults who their food were higher in flavonoids, right, had a 19% reduction in memory loss. And that is attributed to BDNF function. There are 2 things that I want to say about BDNF. One is that food is essential for it, that we know that unhealthy food such as glucose is inversely proportional to BDNF. When you are eating food high in glucose, hydrogenated food, you are going to have a dip in your BDNF. However, when you have your quote-unquote your Mediterranean diet, your fermented foods, which are precursors for butyric acid, your BDNF will go up. Another area that BDNF goes up is exercise. When you are having aerobic exercise, your BDNF goes up. These are the core mechanisms of action for nutritional psychiatry. Going back to your question about injera, right? I don't know specifically how it's done, but if there's fermentation in that process, right? Fermentation will help in 2 mechanisms of action here. One is the BDNF, because fermentation helps with butyric acid. Butyric acid is essential for BDNF and neurogenesis and neuroplasticity. Again, it's microbiome, right? Fermentation is essential because your body cannot use those nutrients. It's the microbiome that will use fermented food. And when they eat those fermented food, they will give you nutrients. They will secrete GABA or serotonin, or depending on the strain of microbiome you have. Now, if you're lacking in this microbiome that is essential for well-being, it doesn't matter what you eat, it will not improve your well-being. And another essential about that microbiome is that microbiome is very genetic. It's very, very ancestral, because what your ancestors weren't eating, you are probably not going to have the microbiome to process that food.
Why is it so important that adolescents and young people who are developing, who are growing, have the appropriate nutrition and all of these beneficial nutrients, if you will? Why is it so important for them?
Okay, so
especially at that age, yeah.
Okay, I think that I'm going to throw out some numbers at you.
Okay.
Bear with me. So it is quite very, very essential that adolescents have essential nutrition. So let's look at what is happening in America today. These children are constantly exposed to trauma in the name of gun violence. What does trauma do to a developing brain? It arrests the developing brain, right? We also know from neuroscience that the prefrontal cortex does not develop fully till you're 25. And this is average, right? This is on average. There are people who theirs doesn't develop till they're 28 and so on. So then 1 in 5 US children have a mental, emotional, or behavioral disorder in any given year. Then 75% of mental illness begins before the age of 24. In 2020, 1 in 6 young people experience major depressive episode, and suicide is the second leading cause of death in people aged 10 to 24. So now let's talk about the fact that when you have this level of trauma going on with these kids, this level of mental illness going on in this population, there is also, if you look at another side of this, is that there is a critical shortage of mental health providers. 80% of rural communities in America do not have a child psychiatrist. Then we cannot medicate every child in this population. That's absolutely not possible if we want to provide care, or we cannot provide therapy for every child. What we do know that most of these children eat. And that to me is a very low hanging fruit where we can do a population level mental health intervention. Because like I said again and again, let's go back to one of the mechanism of action that we talked about, BDNF, brain derived neurotrophic factor. One of the most powerful medications that we have, mood stabilizer that we have, is lithium. Lithium and clozaril are the two only medications that we know that prevent suicide. However, most people will tell you that we don't fully understand the mechanism of action of lithium. But we do know that lithium and clozaril share in common is that they increase BDNF. Now, is it going to be an extrapolation to say that BDNF have an impact in suicide prevention? Well, we don't know that. But what we do know is that BDNF is very essential for brain development, neurogenesis, plasticity of the brain. More importantly, for people who are facing constant trauma like these children are facing. So if there is ever a population level intervention that we can use for pediatric population, nutrition psychiatry is one of the answers.
That's very important to know. And I think it's very important to get this information out there to parents, to teachers, to care providers who can guide what young people are consuming. And here we are with the Minority Fellowship Program, and we're looking at the disparities amongst racial and ethnic communities in this country. So I wanted to pick your brains on this. Are there disparities when it comes to nutrition, the quality of the food that adolescents and young people from ethnic or racial minorities in America consume as compared to the general population?
So I think that unfortunately in America, whenever there is a disparity, ethnic and racial minorities are always the people that bear the highest burden of that disparity. And nutrition is not an exception to this rule. So, a recent study by the US Department of Agriculture confirmed that a connection between race and food desert. So, people of racial and ethnic minority live in places with higher food deserts. Native Americans, too, live in places with higher food desert. And how do we define food desert? It is living 10 miles away from access to a grocery store if you live in rural areas. And majority of minority populations, Native Americans, live in these food desert areas. That's one part of it. Then, because of the economic disparity, unfortunately, healthy food has become expensive. And because of the economic disparities that you see in America today, ethnic and racial minorities also cannot afford this healthy food. Then you have more fast food in these places. And you see that impact across many minority communities.
So what does this mean then for the mental health of young people coming up in these areas that have these food deserts? Like what will the impact of not getting these critical nutrients have on their mental health?
I think when you think about it, right, you go back to my mechanism of action that I did discuss, right? So, and brain development, especially. If we are depriving this population of healthy food, and I don't mean to sound like an alarmist, but the reality is that we are going to have a very unhealthy generation. And the reason is because there is a constellation of many things happening. They are facing trauma. That trauma is untreated. Think about what trauma does to the brain, right? It arrests brain development. Most of them, their prefrontal cortex would not fully develop, right? And this is where your executive function is sitting, right? What makes you, your personality, your ability to be a functional, and what makes you. That is in your prefrontal cortex, right? Your limbic system, your emotion, your emotional being, right? And you see these kids are more reactive. You see that emotion takes the best of them and all of those things. So if we don't provide access to healthy food for this population, especially at this vital time that neurogenesis is accelerated, we are going to miss a critical point in their well-being, and we're going to have an unhealthy generation.
You are hitting on some very important points that have been made by previous guests on this podcast, including regarding gun violence and the importance of instilling impulse control in, for example, communities where people do have guns and do have access to guns. Okay, so that is a right to have a firearm, but that doesn't mean that you pick it up and shoot at whatever provocation that comes your way. And if your emotional development is somehow stunted because you're not getting the correct nutrients, or if that's a contributing factor, then you're contributing to this lack of impulse control that is further traumatizing communities. So very important points that you're making there. So then what do you recommend should be done to ensure that what young people consume does not contribute to their being mentally unwell? You mentioned earlier that this is a low-hanging fruit, nutrition, because everybody has to eat. But then how can you go around having these food deserts? If the food's not available, if the nutrients aren't available, then what can be done?
I think there's a two-prong to this. Catch them young, right? The tongue is like every other muscle. You can train it to like anything. We need to be able to encourage mothers and parents and, caregivers to teach children to appreciate and love their broccoli, because if you expose them to the broccoli, your flavonoids, which are your berries and this and that, the more colorful your plate is, the better it is. We need to inculcate that training, right? When they are young, when they will appreciate it, they will grow with it. That's what they know that is good. That is what they know that is healthy. That is what they know that is sweet. They will eat it. They will enjoy it. That's one. I think that one other low-hanging fruit is a community garden. For most of us in the academy, right, we love our big grant, want to get our grant and change the world. But I think that community garden is such a low-hanging fruit. When I was a rural interprofessional fellow during my rotation in rural North Carolina again, we saw a community garden that cost $1,000. An individual donated their little piece of land. Then the county gave them $1,000 to develop it. You cannot imagine the amount of fruits, tomatoes, cucumber, you name it, that was coming out from that little garden. Not just that there were food, now you're bridging the gap of food insecurity. People from the community have access to healthy food. That's one prong of it. Then think about the fact that we are also building community. Because we're using community level, people are coming together to build this garden. That's another thing. You are empowering this community because they are building something for themselves. That is another prong of it. Then we also know that loneliness is becoming a big thing in America. The Surgeon General just made an announcement about loneliness, and it is effect on mental illness. 58% of adolescents say they do not have a close friend. That in of itself is a problem. If we can do a community garden, gather these young adults to learn a new skill, learn how to plant and maintain a garden, learn how to interact with each other outside social media, you bridge loneliness, you bridge food insecurity, you build community, you empower community. To me, that in of itself is one project that could have a ripple effect and impact. And I say to myself and to my colleagues or during presentation, I say, if Michelle Obama could plant a garden in downtown DC, you could plant a garden anywhere in the world. So it's doable.
Absolutely, it's doable. You're a nurse, and we're talking to an audience of nurses. Hopefully, we have lots of nurses and nurses in training listening to this. What can they bring to the table? Is this something that they can take on?
I think that this should be nurses' bread and butter. What we do is social determinants of health. Nutrition is social determinants of health. What we are good at is those community intervention. That is our bread and butter. And I think that is where nurses really can shine and excel, because we look at health from a nursing model, which is well-being, right? A continuum of health. It's not a pathology aspect of healthcare, right? This is wrong. You have appendix, like cut it out. No, we look at health from a continuum of well-being, whatever that may mean for that individual at that point in time. And I think that nutritional psychiatry is an essential place that nurses can elevate themselves, elevate the care that they provide to community, build partnership and community with these communities, especially marginalized communities, especially where we have these food deserts, that we are doing an intervention that people need and that will advance health outcome for people. I am a TMP prepared nurse. We are trained from an implementation perspective, a system perspective. So whenever I do work, I'm thinking about how can you implement this? So there are multiple ways that a bedside RN can implement. A good example, we do psychoeducation in inpatient psychiatry. As a bedside nurse, empowered with this skill set, you can empower your patients in inpatient during your psychoeducation, right? You are teaching them exactly how you can draw a straight line between this food to this neurotransmitter to this outcome. That right there is something that any nurse can do. When you talk about advanced practice nurses, I've been called upon by psych MPs or people in the academy about what can they do? Like, you have patients who will come in and be like, I am having anxiety, I'm having ADHD, but I don't want to take antipsychotic. I don't want to touch it. Right? For now, I want to exhaust my option. And I get this email. Do you have anything that you can? And one of the things I did was to create a discharge planning for advanced practice nurses. Like, you can, if it's ADHD, here is what you can give to your patient. If it's depression, here is what you can do. If it is anxiety, this is what you can do. right? And when they reach out to me, I share this information with them. Those are some of the ways that nurses can really help advance health outcome and shine and elevate nutritional psychiatry.
Have you received feedback from the patients, from the people who received this advice in terms of using the food that they eat to mitigate some of their mental health problems? How effective was your advice?
I do receive feedback from clinicians who I have made this recommendation for, who have helped their distance. And most of it has been a very positive feedback, right? That, my patient is really impressed, that they are happy about this, they're working on this. One of the major drawbacks that you will have with some clinicians or people will be like, I want to educate my patients on this. I want to do this with my patients, but time is of the essence. Reimbursement is of the essence and stuff like that.
So when you say time is a factor here, is that because you only have like 15 minutes to see a patient and then they move on?
Yes, if you're lucky.
You mentioned that this is a new branch of psychiatry, this nutritional psychiatry, but has it been incorporated into the nursing school curricula? And if not, what are your recommendations for nursing education?
Unfortunately, no, it hasn't been included. As we go into the advanced practice profession, we tend to start moving away from the nursing model of care into the medical model of care. So nutritional psychiatry is one way to bring us a little back to our roots of nursing model of care. Then also it is something that you could implement or use in both undergraduate nursing education and graduate level nursing education. Another reason for it is that it works. We have a better understanding of the mechanism of action and it works. So why not?
Absolutely. It's important on so many different levels. So the next part of my question about how this is being integrated into the profession is regarding the mental health assessments that are conducted. When a patient comes in and you're doing an intake, is nutrition included in the mental health assessment? And if not, why not? And what would the benefits of including it be, especially for young people?
To the best of my knowledge, no. When we do nutritional assessment, we do it from a pathology perspective, right? It's usually those patients that are at risk for eating disorder. We're doing it from a psychopathology perspective. We're not doing it from a well-being perspective. And if you have to do nutritional assessment, it has to come with a cultural understanding, one. It has to come from the frame of social determinants of health. Do you have access to food? What kind of food do you eat? What do you drink at home, at school? We know the correlation between sugar, glucose, and BDNF. The favorite beverage for breakfast in America is soda.
Really?
Yes, I was surprised by that too. But if you look at all those things, accumulation of all those things, we need to be able to have a relatively good understanding of what is our patients eating, when are they eating it, how colorful is their plate, and that color does not have to be synthetic color.
Hopefully not. You're making me smile. But you're very passionate about this, Dr. Agor. And from listening to you, I would imagine that any person who's doing mental health work at any level, if they are about to see somebody new, that they would do this kind of assessment. I mean, it seems to me like it should be one of the fundamental questions that is asked.
I agree. It should be a very fundamental question that you ask. In advanced practice nursing, we have a component of nutrition that we ask. In bedside nursing, we did, but it's usually, again, I said, from a pathology, like when I'm giving Jodon, did you eat? Have you had at least 600 calories or 400 calories before I'm giving you this medication? It doesn't matter where that calorie came from. It's from that interventionist perspective, that pathology perspective. So it's not like looking at the full spectrum of what is it that, people are eating. And I think that another point of it is that how we are educated. I was taught in nursing school, do not do an assessment you don't have an intervention for. And nurses are very apprehensive to do an intervention they don't have an assessment to. If I ask a child, do you have access to healthy food? If they say no, what is my intervention? So because of the lack of education, because that nutritional psychiatry education doesn't stop at telling you what nutritional psychiatry ought to do and mechanism of action and this and that, we have to take it a step further to connect you to the resources, to educate you about the resources in your community that can help with access to food. That was one beautiful thing that happened in my rural interprofessional education. What we learned in these rural communities that there are pockets of interventions going on here and there that people that were in silos, people didn't know, practitioners didn't know, clinicians didn't know. So an essential part of interprofessional education, which is my rural interprofessional education, is knowing your resources. So when we are thinking about including nutritional psychiatry into our curriculum, it has to include connecting people to the resources that help with access to food.
Yeah, I think that's very important, and nurses need to be proactive in finding out this information and helping their clients, their patients, to access these alternatives where they are available. And I thank you very much, Dr. Agor.
Thank you.
And that does it for this episode of Mental Health Trailblazers, Psychiatric Nurses Speak Up. I hope you've enjoyed our discussion, and I look forward to you joining us on future episodes. This is the Minority Fellowship Program at the American Nurses Association podcast, featuring nurse scientists addressing the psychiatric and mental health issues affecting underrepresented communities across America. You can always find us online at emfp.org and wherever you get your favorite podcasts. The views expressed by the speakers and host do not necessarily reflect the official policies of the Department of Health and Human Services, nor does mention of trade names, commercial practices, or organizations imply endorsement by the U.S. government.